Hi, Professor. My name is Samantha Solis. For this week's assignment, the infectious disease that I chose for my topic is human immunodeficiency virus, most commonly known as HIV, and the neighborhood that I decided to target is Industrial Heights. So, according to the CDC, HIV is a virus that spreads through certain body fluids and attacks the body's immune system. When HIV is left untreated, it reduces the number of CD4 cells in the body, which causes damage to the immune system and makes it harder for the body to fight off infections and certain other diseases as well. As of now, there is no cure for HIV. There is treatment and medications that can be taken to best protect the person and to lower the risk of transmission, but so far there is still no cure that we know of. So the chain of reaction for HIV is that the agent is HIV within the human themselves. The reservoir can come in many ways, such as blood, semen, saliva, and breast milk that is given to a child, as well as through needles. The portal of exit is through a break in the skin that can be either mucous or through the vagina, penis, or the breast. The mode of transmission and the place of entry is the same as mentioned already, with all the elements coming together with the body. The only way in breaking the link through HIV is through not sharing needles, by wearing protection when having sex, and also preventing any kind of breakage that can happen within the skin. So the reason that I decided to choose this disease and this neighborhood is because I did see an alarmingly high number of homeless people in Industrial Heights, and with that I also noticed that there was no nearby clinic or hospital within that small neighborhood. There are ways that they promote this by if they have an addiction that help can be given to them, but there is no other information provided for them on how to best protect themselves against other diseases that is not just addiction. So since HIV can be spread through needles, this is a really hard element to control if someone is addicted or if they are using really anything. They will not really care whether the needle is clean or whether they will be susceptible to other diseases. So it makes it very, very hard for those who are homeless to really care about their health when they have limited access to what they need to get what they want. The only way that I could think of that would best protect them is to give them education, to provide them with health care, that they do not have to worry about giving money or receiving any other type of payment for, and they can get that education needed, as well as clean needles. So Clean Needles is a program that can be shared throughout the nation, and it's not meant to promote them to do drugs or to keep using, but it is to promote good health. So if they have clean needles that they have easy access to, we can see numbers lowering in the type of HIV transmissions and can see lower deaths among all people as well. So currently HIV is spread throughout many countries, and it is affecting the lives of thousands of people as well as children. One of the ways to be able to lower the risk is overall education. The only way that it can be best protected is to identify that the person has it, get them the treatment that they need, as well as any other elements that can combine with that as well. It is difficult to put an end to this disease just because people have to go in and get treated and find out whether or not they are HIV positive, and many times that causes a barrier because people would rather not know and would rather not have that element to know within themselves, which makes it harder to give them the treatment that they need. But education is overall the best method, as well as for this particular program, to give clean needles so it reduces the risk of transmission and can best protect the lives of those who are either homeless or those who are just using in general. So this is my presentation, and thank you.